So we're starting off this lecture with the sedative and hypnotic drugs, that is the barbiturates, and the diazepines, that is the benzodiazepines. And we're also going to be talking about some non-benzodiazepine hypnotics. So we said that the sedative and hypnotics basically work through the GABA A receptor, that is, they work through the activation of GABA A receptor, and what it does is that GABA A activation will increase chloride influx and potassium efflux. So if we're looking closely, we're starting from barbiturates. Barbiturates are basically the drugs that potentiate GABA, and they are the drugs that shift the dose response curve to the left, and they basically increase the potency. Okay, so the difference between barbiturates and benzodiazepines is that barbiturates like duration. That means that the barbiturates facilitate GABA action by increasing the duration of the chloride channel opening. So it will decrease the neuronal firing. So you can remember it by barbiturates, that it increases duration. However, benzos, they facilitate the GABA action by increasing the frequency of chloride channel opening. So the frequency, the number of time increases for benzos, whereas for barbiturates, the duration, the chloride channel remain open. This is the mechanism of action for barbiturates. So the barbiturates are basically the drugs that includes the tal in their name. So phenobarbital, pentobarbital, thiopental, secobarbital, all these drugs belong to barbiturates. If we're talking about the clinical use, the barbiturates are used for anxiety, seizures, insomnia, and for the induction of anesthesia. Thiopental is a drug that is specially used for the induction of anesthesia. And barbiturates basically prolong the GABA activity. If we're talking about the adverse effects, the adverse effect for barbiturates is that the respiratory and cardiovascular depression, because barbiturates are the drugs that interact with and induces cytochrome P450, so they will cause cardiovascular and respiratory depression. They will also cause CNS depression, which can be exacerbated if you use alcohol along with it. It is very common to develop tolerance and dependence for this kind of drug, because it is commonly used as, since it's not used, it's basically misused. So people definitely feel addicted for this drug, and it's dangerous as well because there's no antidote for this drug. Benzos are considered safe as compared to a barbiturate. And if we're talking about overdose, if a patient comes to you who has overdosed in barbiturates, you probably have to give them you have to assist in respiration, you have to maintain the blood pressure, and basically barbiturates can induce the production of porphyrins. So it is a drug that is contraindicated in porphyria, which is a very important point. It is never given in a patient who has porphyria. If you suddenly withdraw from barbiturates, the signs that you will face is that you will have anxiety. Obviously, since it is used for anxiety, you will start facing the signs that you were basically taking this drug for agitation, seizures, which can be life-threatening. And the management for barbiturates toxicity or like withdrawal is that you put them not for toxicity but for withdrawal. If a patient comes to you who's taking barbiturates and has stopped taking barbiturates, you will basically give them a long-acting benzo instead of a barbiturates. If we're talking about benzodiazepines, benzodiazepines are the drugs that includes the PAM, and they are the drugs that include the LAM. So this is the way you remember benzos: diazepam, lorazepam, triazolam, temazepam, oxazepam, midazolam. They have a variety of drugs. How they work is that, again, they work through the GABA A receptor, and they facilitate the GABA A action by increasing the frequency of chloride opening. Barbiturates increase the duration. Benzos increase the frequency of GABA channel opening. So benzodiazepines, you can also remember it by this way: benzodiazepine, that means it increases the frequency. And the benzodiazepines, they decrease the resting stage of the sleep, REMs. They decrease the REM sleep, and most of them have long half lives and are active metabolites, except for these atom drugs. So the atom drugs, or you can say the drugs that are included in the atom group, are alprazolam, triazolam, oxazepam, midazolam. They're the drugs that don't have a long half-life, they're short acting, and they have higher addictive potential. So these kind of drugs are basically prescribed if you're going for a dental surgery or a minor surgery and you're facing anxiety. Next, we come towards the clinical use. If we're using benzos, it has to be related to anxiety, or it is given in panic disorders. It is also used as in case of status epilepticus. The drugs, specifically lorazepam, diazepam, and midazolam, are used. They're also used for eclampsia, detoxification, eclampsia, that is seizures that is caused by pregnancy and high blood pressure in pregnancy, detoxification, night terrors, sleepwalking, general anesthetic, amnesia, muscle relaxant. It's also used as an hypnotic. Another important thing is that most of the benzodiazepines, they go through liver metabolism. The only drugs that do not go through liver metabolism and have the minimal first pass metabolism are the OTL, that is outside the liver. So OTL drugs are lorazepam. OTL drugs are oxazepam, temazepam, and lorazepam. These are the three drugs that basically have the minimal first pass metabolism, and especially they're used for those who are suffering from liver disease. If we're talking about the adverse side effects, so the adverse effects of benzos is that benzos are likely to develop, again, you are likely to develop dependence for this drug. It has additive CNS depression effects with alcohol and barbiturate. It has like a GABA through the GABA receptor, so it is that it interacts with the GABA A drugs and increase the CNS depression. And it is also basically the risk of respiratory depression and coma is less compared to barbiturates. And if there's an overdose, we treat it with flumazenil, which is a very important point, which makes it very, very, very safe compared to barbiturates. That we have an antidote for benzodiazepines, while we don't have an antidote for barbiturates. And they can also precipitate seizure by causing acute benzodiazepine withdrawal. So the signs of benzodiazepine withdrawal are rebound insomnia, anxiety, seizures, especially if they were used as an anti-epileptic, okay? Or if you obviously use benzos in high doses, it can cause seizures. Non-benzodiazepine hypnotics include zolpidem, zaleplon, S-zepicolone, the Z drugs. The Z drugs that put you to sleep. So they're basically the drugs that you use in sleep disorders. The Z drugs work on the BZ1 receptor, that is the BZ1 subtype of the GABA receptor. And these are also the kind of drug that has an antidote, that is flumazenil. Flumazenil is basically a drug that blocks the BZ1 receptor. So any drug that is working through the BZ1 receptor, it can be reversed with flumazenil. So the non-benzodiazepine hypnotics, zolpidem and zaleplon, along with the benzodiazepines, they both have an antidote, whereas barbiturates do not have an antidote. They're basically used for insomnia, and the adverse side effect is that it causes ataxia, headache, confusion, short duration because of rapid metabolism by liver enzyme. Basically, unlike the other older sedative hypnotics, only modest day after psychomotor depression, few amnetic effects, they decrease the dependence risk. Then they have decreased dependence risk than benzodiazepines. So you're more likely to get dependent when you're on a benzodiazepine as compared to the Z drugs. If we're talking about anxiety, I can categorize it into two types of drugs that work on two different types of receptors. So we have the drugs that work on the GABA receptor, and we have the drug that work on the 5-HT receptor, that is the serotonin receptor. The GABA receptor includes benzodiazepines, and they are good in acute cases because they have a faster onset. However, the serotonins are slow, so they have a slow onset, and they include the selective serotonin reuptake inhibitors and buciprone. Now, buciprone is a kind of drug that has no effect on GABA. It is not a CNS depressant. It works through 5-HT1A serotonin receptor, that is a partial agonist. It is non-sedative and it has a slow onset and takes 1 to 2 weeks. This is all that you need to know about the sedative and hypnotics.